Yes, rightest is the person who breaks the germ cycle. Mama, what is coronavirus? Coronaviruses are a large family of viruses that are known to cause illness ranging from the common cold to more severe diseases. What are viruses? Viruses are like germs. They are very small, infectious particles that live inside of living organism. They are so small that we cannot see from our naked eyes. Virus can't move on its own, but they spread easily throughout touch. Achik! Achik! See, now you sneezed. If you have cold, my dear, now you sneezed. If you shake hand with your friend, then you can pass the virus to your friends. Yes, when you have cold and wipe your running nose with your hand, and after that if you shake hand, definitely the virus will pass to your friends too. Oh my God, is it? That is why doctors and teachers always advise to cover your mouth when you sneeze or cough. Oh my! Once the virus enter a body, they try to capture a cell and control the cell to make more virus. Virus in the cell keep growing, and once a cell is full of virus, it explodes and spreads the virus. Yes, the virus explodes and spreads to other cells to produce more virus inside the body. Coronavirus is just like any other virus which cause common cold, cough, headache, fever, dry cough, breathing problem. All these symptoms may appear after the exposure to coronavirus. Oh, Papa, are we safe? You need not worry about coronavirus. We all will be fine if we will follow simple prevention steps. The mortality rate of coronavirus is 2%. That means if 100 people get infected with virus, only 2% are likely to die. In the past, we had seen SARS having mortality rate of 10%, swine flu having mortality rate of 45%, and Ebola even more. So, we need not worry about coronavirus, is it, Papa? We have to be cautious. We have to take precautions to defeat this virus. Haha. Can we really defeat it, Mama? Yes, very sure. We can control the spread of coronavirus, and we can defeat it by following simple precautions, by following the infection controls. Coronavirus is a new disease. There is no vaccine until one is developed. It can take time for a new vaccine to be developed. The best way to prevent and slow down transmission is to be well informed about the COVID-19 virus. Know about the disease, its causes, how it spreads, and how to protect ourselves and others from infection by washing hands frequently, using soap or using an alcohol-based rub frequently, and not touching our face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So, it's important that you also practice respiratory etiquette. Papa, tell me some prevention steps. Wash your hands very properly. Maintain hygiene, cleanliness in each and everything and activity. Maintain social distance, that is at least 1 meter distance. Greet without touch. Tell namaste. If sick, must and should follow doctor advice. Can use sanitizer frequently and keep your hands clean. Avoid touching your eyes, nose, mouth. I remember the thought I learnt in my school. Health is wealth. Cleanliness is next to godliness. Come on, let's go into our room. I will show you a few more slides on coronavirus. Know the difference between epidemic and pandemic. Epidemic, whether a disease or a trend spreading rapidly within a community or within a region, whereas a pandemic is what an epidemic becomes once it reaches a far wider swath of people, especially across continents or the entire world. Know the difference between ventilator and respirator. Ventilators are the machines that help patients breathe. Respirators are the protective mask which helps professionals wear. Know the difference between isolation and quarantine. These both help protect the public by preventing exposure to people who have or may have a contagious disease. Isolation. Isolation separates sick people with a contagious disease from people who are not sick. Quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. A quarantine is a period of time where someone stays at home. It's the next step in social distancing to flatten the curve or slow the rate of infection. Coronavirus disease. COVID-19 is an infectious disease caused by a newly discovered coronavirus. Coronavirus disease 2019, that is COVID-19, is defined as illness caused by a novel coronavirus now called Severe Acute Respiratory Syndrome coronavirus 2. Coronaviruses are a large family of viruses that are known to cause illness, ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome, which was first identified during an outbreak of respiratory illness cases in Wuhan City, Hebei Province, China. Older people and those with underlying medical problems like cardiovascular disease, diabetic, chronic respiratory disease and cancer are more likely to develop serious illness. The people who work in health centers, healthcare workers, come into contact with patients more often than the general public. WHO recommends that healthcare workers consistently apply appropriate care and measures. Can coronavirus be transmitted from person to person? Yes, some coronaviruses can be transmitted from person to person, usually after close contact with an infected patient, for example, in a household, workplace or healthcare center. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth which may contain virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus if the person coughing has the disease. Remember, the COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So, it's important that each one of us practice respiratory etiquette . Let's see what are the symptoms of someone infected with the coronavirus. It depends on the virus, but common signs include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Most people infected with COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. What can we do to protect ourselves from coronavirus? Standard recommendation to reduce exposure to the transmission of a range of illnesses, including maintaining basic hand and respiratory hygiene and safe food practices and avoiding close contact when possible with anyone showing symptoms of respiratory illness such as coughing and sneezing. Yes, the best way to prevent and slow down transmission is to be well informed about the COVID-19 virus, the disease, its causes, and how it spreads. Protect yourself from others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. Wash your hands frequently, regularly and thoroughly. Clean your hands with an alcohol-based hand wash or hand rub or wash them with soap and water. Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Avoid touching eyes, nose and mouth. Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter your body and can make you sick. Maintain social distancing. Maintain at least 1 meter, that is 3 feet distance between yourself and anyone who is coughing. Practice respiratory hygiene. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Droplets spread virus. By following good respiratory hygiene, you protect the people around you from virus such as cold, flu and COVID-19. If you have fever, cough and difficulty in breathing, seek medical care early. Stay home if you feel unwell. If you have a fever, cough and difficulty in breathing, seek medical attention and call in advance. Follow the direction of your local health authority. National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of viruses and other infections. This will also help to prevent possible spread of COVID-19 and other viruses. Follow the guidance outlined above. Stay at home if you begin to feel unwell, even with mild symptoms such as headache and slight runny nose, until you recover. Mnemonic of coronavirus. Cleanliness. Cleanliness promotes better health. One who maintains cleanliness keeps away diseases. Right respiratory etiquette reduces the spread of COVID-19. One who follows cleanliness kills tomorrow's diseases. Nothing inspires cleanliness more than being healthy. All hands are requested to help keep self clean. vulnerable is this coronavirus. Avoid its spread wisely. In every aspect of life, follow infection control as a knife. Responsibility is everyone's. Let's put our efforts to put an end to COVID-19. Universally, let us save our universe from COVID-19 by protecting ourselves and others. Sanitation and hygiene, safety and care are the shield for us. Hold the shield and protect yourself.